Bismillahirrahmanirrahim. I am Dr. Sayyid Raza Mohyuddin, member of the visiting faculty, Time Institute Multan for MPH classes. And today is the ninth lecture of health promotion, health communication, and health education. And today we will discuss two theories, model of health promotion, and the first is information processing model. So this model, as you learned the previous theories and models, and let's continue with that, this information processing model. The information processing model is a framework used by cognitive psychiatrists, psychologists to explain and describe the mental processes. As you know, because it is used by psychologists, so that will be concerned with the mental function and processes. This model is like the thinking process of a computer, that you just imagine how a computer works. Our mental functions are like computer. So just like a computer, the human mind takes in information, it organizes the information and stores it to be retrieved in a later stage. We take information in our brain, and then we organize it in our own way, and then it is retrieved whenever we have to make a decision. So the consumer information processing is the process of how buyers comprehend the information that is being given to them. So this comprehension, this information is based of cognitive and affective elements, and which are thoughts and feelings. The thoughts and feelings are being conveyed to our brain. So consumer information processing contains these four components. It is exposure, attention, comprehension, and then elaboration. And all these four components are itself they are explanatory. And this information process, as you saw, exposure, when you come across to some information, you are exposed to it, then you give attention to this information, and then you make a comprehension. You get an idea of your own in your mind, and your mind accepts that idea. And when your mind accepts that idea, it is stored in your mind, then it is retrieved at the certain times. So for the information, there are stimuli, and it can be, the attention can be involuntary attention, it can be a motivation, it can be some, ability. And then it is, accepted in our memory, which can be, sensory memory, it can be a short-term memory, or it can be a long-term memory. Then there are the stages in information processing, and these stages are, those in order, they include attending, encoding, storing, retrieving, as already I told you. And encoding is a new word because then you give your own words, your own meanings to this. And this is also, this information process talks about three stages of receiving information into our memory. These include sensory memory, short-term memory, and long-term memory. And you are all familiar of these words. Then there is your decision-making process. Consumer decision-making process is, that it involves the consumers. Here the consumers may be our patients or clients, to identify their needs. They identify their needs, they gather information, then they evaluate alternatives and then make their buying or accepting decisions. So the consumer behavior may be determined by economic and psychological factors, and they are influenced by, always when there is a decision making process, it is influenced by environment and then also factors like social and cultural values. So you work as per, in accordance with your social and cultural values, and of course you are influenced by the environment. Then what is this, the importance of this information processing? The computer receives the information, that is the input, it stores and processes, and then it delivers output. But human gathering the information is from sense, from their own sense, and they are stored to process by their brain, and then gives the output behavior wise. So the cognition process as a goal in everyday life. So this is the how the information processing model of computer applies to the human behavior. Then is the, what is the role of consumers in healthcare? In healthcare, the same principles can be applied to patients and consumers. A patient is also a healthcare consumer, but a consumer is not necessary that he may be a patient. So patients are consumers in one simple way. Patients receives care while consumer make choices. And the healthcare consumers are the key stakeholders in the patient-oriented and patient-driven care. So these consumers play a critical role in the medical decision-making process and making choices that ultimately impact the value of care delivered on both individual and societal levels. Now the second model is ecological model. The ecological models have a long history, so they are concerned from, emerged from developments in many discipline fields. For example, this ecological model is seen in public health, in sociology, in education, and in psychology. And these are in turn converge to form the physical and behavioral, the biological foundations of health promotion. In this, ecology is the word derived from the biological sciences. It describes the complex interrelationships of organisms and the environment in which they are embedded. So ecology is the science of the organisms in relation with their environment where they have the habitat or where they are embedded. And what is the social ecology? This is the biological ecology, and the social ecology is the study of the influence of the social system or social context on behavior, including the institutional and cultural variables. So this is biological ecology, and then is the social ecology. Then these ecological models have evolved in behavioral public health. This focus on the nature of people's transactions with their physical and socio-cultural surroundings, that is environments. So as we all are concerned where we live, where we work, from where we have get our learning, where what are the recreational centers. From all there, we define our behavior. So the behavior of all the human beings is derived from their genetics, from their brought up place, from their schooling, then their workplace, and then of course the places where you perform your recreational, and then is your family life. All these are the ecological social environment of human beings. So these are concerned with the development of our behaviors. So in the past few decades, there has been a dramatic increase in the interest and in application of ecological models in research and practice. And as because I've already approached the reason is due to the changing behaviors that affect our you know health problems. Then the ecological models of health behavior is a model which emphasizes the environmental and policy contexts of behavior while incorporating social and psychological influences. So ecological model had to explicit multiple levels of influence. So thereby they guide the development of more comprehensive intervention. So it is not a simple intervention, it is a comprehensive intervention by the behavior of the person itself along with the social and psychological influences. Then these models they provide comprehensive framework for understanding the multiple and interacting determinant of health behavior. So more importantly, ecological models can be used to develop comprehensive intervention approaches that systematically target mechanism of change and each level of influence. So now you see there the involvement of this model in the health promotion is explained because they, they develop a intervention which target the mechanism of change at the level of the influence. So the core concept in an ecological model is the behavior that has multiple levels of influence. So that level can be intrapersonal, that is this biological and psychological within the person itself. Then it can be interpersonal. Interpersonal mean between the persons, that is the social and cultural. And then is the organizational level, community and physical environmental, and then is the policy level. So there are five levels in ecological model. That is the interpersonal, intrapersonal, interpersonal, organizational, community, and public policy. So these, the intrapersonal level, they are individual and personal. These are the individual characteristics that influence behavior, knowledge, skills, and self efficacy. Then we see the interpersonal levels. There's a family, friends, and peers. And these are the interpersonal processes and groups providing identity and support. Then the organizational and cultural, these are the churches, stores, community organizations, mosques, wherever you sit this. These are the rules, regulations, policies, structures constraining or promoting the behaviors. Then, the level, then again, interpersonal, individual level, interpersonal, organization, community, and public policy. Then there are four core principles of ecological models of health behavior. They are the There are multiple influences on specific health, including factors of the interpersonal, intrapersonal, organizational, community, and public policy levels. So they interact across these different levels. So the ecological models should be behavior oriented, identifying the most relevant potential influences at each level. So multi-level interventions should be the most effective in, for this behavior. Then the ultimate process of ecological models of health is to inform the development of comprehensive intervention approaches that can systematically target mechanism of change at several levels of influence. So these behavioral changes are expected to maximize when environments and policies they support the choices. And then when social norms and support for health choices are strong, and when individuals are motivated and educated to make those choices. When there is positive effects on all the levels, there is a good sporting policy, there is an organizational sport, and then is the family and community sport, and the person itself is motivated. So this model of health promotion will work well. And then this if we conclude this model, we will say that they help to understand how people interact with their environments, and that understanding can be used to develop effective approaches to improve health behaviors. And motivation and skill in individual cannot affect environment and policies alone. So make environment and policies convenient, attractive and economical, then motivate and educate people. Thank you very much.